The Vatican's message about Pope Francis's recovery was vague, but medically, it said a lot, and one specific piece of information shows he's ahead of the curve.
I was actually quite stunned. In my experience, they usually a couple of days before they have. They give the patient clear liquids before he eats solids. But from what I read this morning, he was given a solid food meal already.
The Pope's surgery to remove part of his colon that had narrowed lasted 3 hours. Dr. Robert Tiballi of the Catholic Medical Association explained how it was done.
They basically snipped at one end, snipped at the other end, and then reattached almost like you would a garden hose.
The condition is called stenosis. It happens when little pockets form inside the intestines and can cause blockage.
The Pope has been suffering from recurrent diverticulitis, which is an inflammation of pouchings of the bowel called diverticulosis.
Diverticulosis is common and on the rise across the world. In the U.S. alone, nearly 60% of adults over the age of 60 have it. Dr. Tiballi says that's because the walls of the bowel weaken.
With age, the inner lining actually herniates through the muscle walls.
Sometimes people who have diverticulosis don't know it because there are no obvious symptoms. But those trying to prevent it stay away from food like seeds and popcorn.
This can get filled with non-digestible food matter and can block fecal material in there, which can lead to infection.
Normally, diverticulosis doesn't become a threat until your late 40s. The only way to prevent it? Stay on top of getting colonoscopies. Based on his seemingly speedy recovery, the Pope most likely had his surgery done laparoscopically through his belly button. But he's expected to stay in the hospital for 5 days. Jessica Easthope, Currents News.
If you're watching Currents News on YouTube, be sure to hit the subscribe button and click on the bell to get updates to all of our newest content, because we are putting your faith in the news.